Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Thank you so much for joining us on Facebook or Twitter. This is, as always, your chance to get your COVID questions answered. And today we have a very special guest who is very busy but taking the time to answer questions. This is Dr. Torres, the interim CEO of Chicago Public Schools. So do you want to go ahead and just introduce yourself so folks know who you are?
Sure. Thank you, Dr. Arwady. Hi, I'm Jose Torres. I'm the CEO, interim CEO, and actually I'm back at CPS. I used to be a network chief in Englewood, West Englewood, Grand Crossing, Abu Ghraib, and Chatham in 2006 and 2008. And so this is kind of coming back to CPS, and I'm excited to be here with you.
Absolutely. So we've already been getting a lot of questions in as we were previewing you would be on, and we are keeping a focus on the Facebook Lives over these next few weeks, really on return to school and children and all things related to that, because we know it's a major focus. So we'll get to as many questions as we're able to, but rest assured that there are multiple town halls that are happening next week. I think you're part of those. I know my team is part of those. So there will be other opportunities to get questions answered. First, though, let's take a quick look at our data and see where we are. So as always, chi.gov/COVID- is where you go. And you see here that our case count is now over that 400 mark. We're averaging 419 per day. The good news is our hospitalizations and our deaths remain low. We've got about 18 new hospitalizations a day and about 2 deaths per day at the whole city level. We're doing over 4,000 vaccinations a day, which is good. And we've seen some of the actually most progress in terms of vaccinations in adolescents. So that's been the group that's been growing the most. We're doing a lot of testing, and we've got a positivity rate now of 4.3%. Just because we are going to be focused on kids, I'll also just remind you how you can look at what's happening with data related to children. So if you look under cases here, and you click here and you say age, I want to see all of this by age. You can then pull this over and say, I just want to see it over the last couple of months, for example. So this here will actually show you, in terms of cases, what's happening with age. And so you can blow this up so people can see it a little bit bigger. And what we see here is that, you know, we're having the most cases, the highest case rate in people in their 30s, in the light blue, followed by people in the 18 to 29 range, followed by people in their 40s, and then this dark blue here is our 0 to 17-year-olds. So seeing some increase, just like we always do whenever cases are on the rise, but nothing unexpected, nothing surprising related to kids. And you can also look at things like hospitalizations, and we can look at that by age. So in the same way, if we blow this up, you see here that in gray, these are our 80 plus who remain just at the highest risk. And the biggest risk factor, you know, of all, you know, for the adults is vaccination status. But the children here, again, the 0 to 17 in the dark blue on the very bottom here, continues to have a very, very, very low hospitalization rate, which is obviously reassuring. And then similarly, if you look at deaths, really the children don't even turn up. We've had one death in recent months in a child who was under 17. That was a child with a lot of really severe underlying conditions, homebound, who unfortunately was exposed to an unvaccinated family member. So the good news is that from a case, hospitalization, and especially death perspective, the news, thank goodness, continues to be really good when it comes to kids. And then the last thing is you can look at vaccines, you can look by zip code, but if we just look at age here, you see that 54% now of Chicago's 12 to 17-year-olds have gotten a first dose, and about 43% have completed that vaccine series. So with that, I just wanted to set the stage a little bit with some youth data. Let's go ahead and turn to questions for Dr. Torres or for me. And as always, you can put your questions directly into the box below, or you can use the hashtag AskDrArwady on either Facebook or Twitter. And we got a lot already coming in. So let's start out. Porch Pain on Facebook says, how can we ensure kids going back to school is a safe thing to do? I'll let you start off.
Well, thank you. That's a great question. And you know, our desire and our highest priority is the safety of students, teachers, staff, everyone in the community. And we have been shoulder to shoulder with CDPH, IDPH, and CDC following the science, trying to make sure that we have all the mitigation efforts that we can have. And so, as I like to say, CPS was among the first, certainly the first in the state to require universal masking. CDC followed us, and the governor followed us. And now that's a staple. We expect everyone, vaccinated or not, to be masked. We have hand washing stations. We have ventilation efforts. We've invested hundreds of millions of dollars in our schools to make sure that people are safe.
Ventilation, especially,
ventilation,
I know. Yeah.
Obviously, and additional custodians, cleaning, and we are promoting and expecting, following CDC guidance, that students will be 3 feet distance wherever possible. So sometimes that means that your children might be eating in the cafeteria if there's enough space, or they might be getting grab and go lunch so that they can eat in the classroom. So the other really important part, and I've learned this from you and the experts, is contact tracing.
Yep.
So we have a robust team that is doing better than 24-hour contact tracing. They're doing it between 6 and 12 hours.
Yep.
And so what you can expect is that if a student is found to be positive, we will be contacting parents through email or through other means, and then we will follow through with all those people and expecting them for them to follow their directions from the health providers.
Yeah, great. And there's a lot of questions here. I see at G3, this is too long, at G3RM4N something on Twitter saying, hey, Dr. Arwady, still think it's safe for children who can't be vaccinated to go back. And I'll start with that, and then you're welcome to chime in. So to add on to what Dr. Torres was saying, those of you who have been following CDPH on this all along know that we were very strong advocates for bringing kids back in person. At the beginning of the school year last year, CPS made that conservative decision where we were still learning a lot about COVID. There were a lot of worries about spread of potential outbreaks in schools, et cetera. But one of the things here in Chicago was that CPS really went full in on making sure virtual learning was in place and that all of the technology, but we did have school systems actually be in place throughout the school year, including the Archdiocese, which is the largest private school system in the US. And so at the health department, we actually had an opportunity to follow students and staff in the in-person setting, students and staff in the non-in-person setting, and in the community. And what we saw is that with proper mitigation procedures, the masks, the distancing, the hand washing, all of these things that sort of come together, the ventilation, even before a vaccine was available, we absolutely could have kids in person. And we saw that not just here, but across the country. And we saw actually lower rates of COVID among the kids and the staff who were in those in-person school settings where we're paying attention than not. And so particularly knowing about the learning loss, the social emotional pieces, just how disruptive this has been for kids not to be in school, I feel unbelievably strongly that it is absolutely the right thing to have kids back in school, whether or not they're vaccinated. I really want to, as you said, commend CPS for taking the leadership role in terms of masks, but also what's happening with vaccine. You want to talk a little bit about that? Because we got a lot of questions there too.
Yeah, so obviously we've been promoting and helping any age-eligible young person, 12 and over, to get vaccinated.
Yep.
We have set up 3 sites. We've been pushing people to go there. And most recently, we made a decision to require all staff to be vaccinated by October 15th. And so all staff in CPS, all vendors, all visitors, anyone who comes into the building, we expect them to be vaccinated. But my daughter, when I got my doctorate, said, "You're not a real doctor." So I'm going to let the medicine, you answer the medicine questions, but I'll tell you about the education piece.
Yeah.
Our students lost a lot.
Yes.
From a academic perspective, from a social emotional perspective, we know that learning happens through social interaction.
Yep.
And so what's different this year from last year is that there is no virtual option. Everyone, all the students are going to be with their peers, learning together, learning from each other, learning academics, but also social behaviors. And so the only, and so that's a requirement from the Illinois State Board of Education. So we have no choice in that matter. We do have a virtual academy for those students who are medically fragile, for those who are homebound, with the doctor provision. And I should say, by the way, that vaccinations for adults at CPS are based on the only exceptions are religious and medical exceptions.
Yeah, and that's really, there are not that many school systems that have really stood up and said this is going to be a requirement. And, we've seen different employers around the city. There's a lot of conversations happening about this. But, I'm so pleased. First, that masking, right? Like before this even became a thing, that's clearly an important part of safety, particularly as we start school and we're working on getting more people vaccinated. But also, this vaccine requirement, where you've got adults vaccinated, we've learned time and time again, that's the most important thing in terms of lowering the risk for kids. So
right, and and we can't do contact tracing. I talked about our contact tracing team. We can't do that without testing, and so we've made a commitment to test staff and students on a weekly basis beginning with the school year.
All right, good. All kinds of questions here. So let's take Lee Mabry White on Facebook is wondering a little more about air filtration or ventilation. Is it in every single classroom? What's the story with that?
So my understanding is that that we have HEPA filters, that we've been investing in these equipment so that the ventilation is supportive of our mitigation efforts.
Yeah, and I can actually add to that because some of the work as we were working to really make sure students were going to come back last spring, online is available sort of classroom by classroom, every space. Like there was work with industrial hygienists to look at every space and make sure that all of the spaces had the adequate ventilation and filtration. So that was a big investment, a little bit before your time, but I know you've definitely kept that up. And it's one of the important things. It's expensive to make those investments, but there's been some federal money available to do that. And it's something that will help keep schools safe for long term as well. And so there is more information on the CPS website about that if you want to see it. Okay, we've got a couple questions here. Should I do routine testing for my children once they are in school? And the questioner says they're not vaccinated. Mary Bonhomme on Facebook, I'm just trying to get a few in here at once. Are children going to be required to have a negative COVID test, or for kids 12 and older show proof of vaccination before school starts? So lots of things in there. Let's take what's happening with COVID testing. Do kids have to have a negative COVID test to show up? And then what is the requirement around vaccination for school? Let's do testing first.
So I would be remiss by not saying that the first day of school is Monday, August 30.
Yes.
And we want all children to come, and no test required, no vaccination is required. We will be providing tests and opportunities for testing beginning that first week. So that's the most important part, because we're starting the school year a week earlier, and so it's Monday, August 30, first day of face-to-face instruction, 5 days a week. With regard to testing, obviously we will have testing available, and parents can choose to have their children tested.
Yep.
We will not be requiring vaccinations for even students who are eligible, except for athletes and those involved in extracurricular activities. We will be requiring that they either get a test or that they get tested on a frequently basis, again, following CDC guidelines.
Yeah, and that's part of because we've seen frequently that as opposed to the in school time where there's more possibility to be still and separate, et cetera, in athletic settings where people are breathing harder and the mask, you've got them, but it can be a little challenging. We've seen outbreaks much more associated with those kinds of extracurricular activities. So the requirement, to be clear, will be for testing for those student athletes. There's no requirement at this point for vaccination for students, but we are going to be making vaccination opportunities available, right? This has been something we've been partnering on, and we know even before COVID, school is an important setting where we make sure kids, can get connected to routine childhood vaccines, and that's going to be something we definitely keep working on. All right. Let's see. We've got Madeline on Twitter saying, we're facing a mental health crisis in addition to a pandemic. What support is CPS thinking of providing for student mental health? Many students have endured the loss of loved ones to COVID, ongoing violence in the city. Talk a little bit about how you're thinking about that.
So we have a strong social-emotional learning curriculum and program to support students. We're using some of the ESSER funds, the federal funds, to support social-emotional learning, and we've also invested in counselors and nurses and social workers over the last few years, and we have a commitment with our negotiations to continue to do that over the next few years as well. These first few years, what we've been saying to teachers and principals and everyone on the school staff is that academic is important, but we need to make connections with their students when they first come in. So the first few days, 30 days probably, you'll see a lot of sort of team building, getting to know you, and ensuring that students are feeling safe and welcomed and ready to learn.
Yeah, and I'll just add, I see there's some questions about mental health kind of more broadly in the city, and actually at the budget forums this last week, I shared a lot of information about what at the city level is happening, where we're really investing to make sure there's more access to mental health care, partly in conjunction with CPS in schools, but also outside of that as well. And so even at the CDPH clinics, we've started for the first time in decades offering some child and adolescent services, and the investments that we've made in mental health with clinics really in some of the areas of Chicago where that's most needed, the huge majority of those are serving adolescents and children as well, because we know that that's a need, and it's been an increased need in COVID. But getting kids back in school is part also of getting them connected, to those sorts of supports. And I've done a lot of interaction with, some of the teens and the youth council, and they have been very open about, their mental health and their sort of social struggles. And, you think about your time as a teenager, so much of that is actually about the interactions and that emotional kind of learning that comes along with school. So that'll definitely be a part of it. Okay, a lot of questions here. So we've got some people with some mask questions. Andrea Arujo Ayala is saying, are masks still the best way to protect our kids, especially the kids that are not vaccinated? We've got some people saying, why does my kid need to mask? They're less likely to get COVID. We've got Don Wolf saying we've had a lot of kids testing positive. That's nationally. How can parents be confident their kid is going to be safe in a room with others? Is 3 feet enough, et cetera? So do you want to start with that? And then I will chime in on some of the data.
So one of the challenges, right, is that who knows who's been vaccinated. And so when I was talking to a principal about when we were making the decision about universal masking, I said, how would you enforce that? And he said, Dr. Torres, we don't know who's been vaccinated. And so students could say they're vaccinated and take their masks off. We don't have time to check. And so based on those kinds of conversations, and of course the CDC and the articles that we've read, we believe that the safest way to move forward, and there's lots of research, and you know that better than I, that universal masking, that when students are masked indoors, it helps to protect them.
It does. And I think, for whatever reason, masks have been fairly politicized in this country, but where you actually look at some of the data behind them, for me, especially in the kid setting, one of the things that's been most notable is that in the year where we were doing more masking, not only did we see lower rates of COVID, we basically didn't have a flu season. And where you're thinking about kids, we weren't seeing the ear infections and the respiratory infections and all of these other things because we were wearing masks. And so, we're going to keep learning about COVID and COVID risk. But right now, particularly with this Delta surge across the country, masks are a big piece that have kept school settings safe even before a vaccine. And while, here in Chicago, I'm glad more than half of the adolescents have at least gotten that first dose, but we have a long way to go. And then, of course, the younger children are not eligible yet. We're not saying masks are necessarily forever here, but for right now, as we're getting everybody back to school, the primary goal is let's get back to school. Let's get that done. And masks are an important part of having that be as safe as possible. We've changed some of the guidance around, for example, indoor versus outdoor masking as we've learned more that the risk is lower out of doors. We're going to continue to absolutely do the best job we can in terms of following that science and make that recommendation based on our local epidemiology. But one of the reasons I showed you the data from Chicago on kids is that we have had a major focus on children from the beginning of this outbreak. I've got a whole team that does nothing but investigate cases in kids and in camps and in schools and in daycares and really make sure we have a good understanding of what those risks are and how to mitigate them. So, I think this is one of the things that helps make things as safe as possible as we get back to school.
Yeah, and just to reiterate, last year when we opened schools, we never had to close schools.
That's right.
We had universal masking. We had a lot of mitigation efforts. Private schools, as you mentioned, were open the entire year, and they were able to function. And I can't overestimate how important it is for students to be back in the safest place that we know in our society, which is schools.
Yep, absolutely. Miriam on Twitter, I think this is aimed a little bit at me, says, previously you've mentioned 400 cases per day as a line in the sand. Now you say vaccines change that. What is your current line in the sand? It's hard to know and trust even if it keeps moving. So we actually have not changed any of those cutoffs at any point throughout COVID. So as we move, and if you think back, if you look all the way back, when we get over 200 cases per day, that moves us into moderate, or what the CDC is calling substantial. So we've been saying substantial risk of transmission. And then when we move over 400 cases per day, we move into a higher risk setting for transmission. When we get over 800 cases a day, that's the highest risk setting. But I want to be clear that that risk is especially for people who are unvaccinated. And so as vaccine has come into the picture, what we've seen is that the other indicators that we follow have actually stayed at that lower risk level. Yes, our percent positivity is over 4%, but while we're under 5%, we actually are in that lower risk category, not even the moderate. CDC defines anything under 10% positivity, right, as in that moderate. Our hospitalizations, our deaths remain low, and that is because vaccine is available for adults. It is older, unvaccinated adults who continue to account for the majority of our severe outcomes, and that's where a lot of our focus has been. So we are doing a press conference at 2:30 this afternoon, and we're going to be talking a little bit more explicitly about that 400 mark and what does that mean for Chicago as we look ahead. But I want to be very clear that in no way does it change the recommendation related to being able to have school in person. So you can tune in at 2:30 if you want to hear some more about that. But I've been really careful to try not to change those lines, to try not to change those data. I know it can feel like things are just moving all the time and where are they? But those risks are based on, if you're out and about in Chicago, how likely is it that you will potentially encounter somebody with COVID? And it's not only about cases, it's also about positivity. But as that one moves to the higher risk, even while our positivity is in the lower risk, that's some of what we're looking at. And so as you know, currently we've had this recommendation, you've got to have a mask indoors, right? That's when we got over the 200 case mark, and we'll be talking some more about that this afternoon. Okay. So some more questions about, let's see, there's some questions about remote learning, there's some questions about quarantine. Let's start, actually, a couple of questions here about young students and teachers and boosters. Let's start with those. So Jessica Klonsky on Facebook is asking, should teachers of young unvaccinated students take a booster? Do you know the answer to that, or do you want me to take that?
I think you should take that.
I will take that. So there is a lot and again, we're keeping this really on schools and students today, so I'm not going to talk about this news that came out overnight, which is not a recommendation yet, to be clear, that there is real consideration for booster shots. At this point, the only recommendation for a booster shot, and we're going to talk about this in 2:30 in some more detail, is for people who are immunocompromised. And really, that is defined as people, we'll go over the details, but who currently are undergoing treatment for cancer, recent bone marrow transplant, on immunosuppressant medications for an organ transplant, or are on, have a primary immunodeficiency or untreated HIV. In those cases, that's about, we estimate about 2.5% of Chicagoans. Those folks should, at this point, get a third dose of either Moderna or Pfizer, the same one that you got for your first two. There's no recommendation for an additional dose if you got Johnson & Johnson. And to be clear, there is no recommendation that teachers at this point or anybody else needs to get a booster. As we see what this data is based on, as we think about prioritization, it's really our oldest folks who we know are at highest risk. And I've been sort of hinting all along that if and when we saw a potential booster, I think it would be most likely to at least start with thinking about folks in the nursing homes or those oldest Chicagoans. So that may be a recommendation that's coming, and I think particularly part of the thinking here may have been, and again, I need to see the data myself, but part of the thinking may have been as we move into flu shot season, if it looks like we're going to potentially need a booster for some folks in the next 6 months, we would much rather sort of do the lift for flu vaccines and COVID vaccines at the same time. But the top priority is getting folks vaccinated who have not been already. That is by far the most important. So there is no recommendation for a teacher to get a booster shot at this time, but if and when there are recommendations, just like right now, only for immunocompromised, we will do that, and we will certainly prioritize, as that's appropriate and we're able to in the school setting, just like we did previously.
Yeah, and I would just say that our focus is working with you and CDPH to get guidance. And so, again, Monday, August 30 is the first day of school, and we think that students will be safe in school. The state of Illinois has given us guidance with regard to in-person instruction, and so we're following that. They've also given us guidance around serving students who are quarantined, and so we are presently in negotiations, and so it may be too soon to say what we're going to do, but we're certainly looking at what CDC is saying, and our recommendation, our position is that those students who are not vaccinated will be quarantined for 14 days, and we'll follow Illinois State Board of Education guidance with regard to instruction for those students. And for those students who are not vaccinated, again, based on CDC guidance, they will not be quarantined.
Yeah, and this has been one of the, most of the conversation at the national level has been around things like vaccine requirements for staff or for masks, but there are these conversations, a little more under the surface. And, for me, I'm really pleased with the CDC guidance that recommends that where people are fully vaccinated, assuming they, are asymptomatic, don't have symptoms, et cetera, that there's not a need to quarantine, because that also helps not disrupt learning. And it's always possible this guidance could change. We're going to see different settings decide to take more conservative approaches at different points. But one of the most important reasons, parents sometimes say, why should I get my child vaccinated? They're not that likely to get severely ill, is that, having a vaccinated child makes it much less likely, where you look across all of the activities that kids may be doing, that they're going to need to quarantine, that they're going to get pulled out of it, that they're going to be disrupting their schooling or other experiences. And then if you are in a situation where you're needing to think about childcare or elsewhere, that is one fewer thing to worry about. And so that's this summer we've been using that policy broadly with athletic teams and with some of the camps, et cetera. Again, it's going to be a continued conversation, I think, as we learn more through the year. But at this point, for 12 to 17-year-olds getting vaccinated it lowers their risk of getting COVID, but it also lowers their risk of needing to quarantine if they are exposed to somebody. And we will see cases, to be very clear about this. COVID is not gone. COVID is not going to be gone, but we've not seen schools drive outbreaks where all this mitigation is in place. We've not seen them drive major problems in the community. And with all of the appropriate, careful case investigation, ventilation, all of these things that are in place even before vaccine, we were able to have school in person. All right, there are a couple of folks here who I just want to address very quickly. At SupermoonPix from Twitter says, can you elaborate on why masking is a good idea? Evidence has shown that wearing a mask all day makes kids more likely to contract COVID, not to mention all the detrimental effects of wearing a mask. That is not true. If you go to the CDC website or the CDPH website, there are some links about this. Absolutely, wearing a mask does not in any way increase your risk of getting COVID. It also does not make you retain carbon dioxide, which we sometimes hear. It does not make you have any other problems. And we've seen kids and adults wear masks without difficulty. So, if you want to send where you're seeing some of that information, I'd love to kind of take a look at it, and we could even address it next time if there's something specific. But not only are the kids less likely to contract COVID, they're less likely to contract all those other respiratory diseases, like I was saying at the beginning. Okay. And another one here, just along the same lines I want to hit. Myra Sofia Delgado says, and this is a good question. She's saying kids with asthma, mask can trigger an asthma attack. What do we do if that's our case? So those of you who were on last week, I had a full-time pediatrician and her son who also are related to me and who I talk to a lot. But that 8-year-old does have asthma, and he's been able to wear that mask consistently. Again, the masks do not trigger asthma attacks in and of themselves. And obviously, we want to make sure kids have access to their inhalers and all of that. But really, we've seen a big decrease in asthma because a major trigger for kids with asthma flare-ups is respiratory infections, right? When kids get their colds and their, all the things that kids pass around, that is the major asthma trigger. So asthma has actually been way down as a result of mask wearing. And I'm hopeful that we'll continue to see that. Okay, so a couple more things. You had touched on some of this, but just to make sure, where did I see this? About, somebody had some more lunch questions. Where did it go? Sorry, there's just so many questions. I don't see it right here, but someone was asking about, can you talk a little bit more about the lunch procedures and what that might look like, because they have to take off the mask to eat?
Sure. So our students are going to be able to, we'll have masks during the day. For lunch periods, they will be able to take the mask off. Because students are going to be in the cafeteria, some of them will be able to eat in the cafeteria where there's space sufficient, and some will be taken, do grab and go, so that they can eat in a place where they have more space for themselves. I just want to add one more item, and that is that when you think about our lifetime, right? So I'm an older guy, so COVID has not been a huge part of the proportionate of my life. When you think about children, if you're 6 years old, it's almost 2 years of your life. It's a huge part of your life. And so that's why I think from an educational perspective, from a social emotional perspective, it's so important to have our students back in some regular settings with actually appropriate mitigations.
Yeah, and Miriam on Twitter, I found the questions here, was asking, just saying lots of parents might feel more comfortable with outdoor opportunities. Is Chicago Public Schools thinking about systems to support this, tents for lunchtime? I'm not sure where that thinking is.
So wherever there's possibilities, I know that some high schools were looking at going outside. It's wherever there's an opportunity. What we did not want to do is direct 600 principals about what to do. Because their context is different. And so the local school has flexibility in ensuring that students are able to eat safely.
Okay, perfect. Taryn Kurth is wondering, what is the time frame for contact tracers to notify affected students that they've been exposed?
Well, my understanding, and you probably should take this question, is 24 hours. And my data from CPS says that we've been able to follow through with between 6 and 12 hours.
Yeah, and I'll just double down on that a little bit. So there has been a lot of work within Chicago Public Schools to create sort of their own contact tracing apparatus. Obviously, Chicago Department of Public Health has supported that and been part of what that looks like. So what happens is when there's a case, the contact tracers within the school setting, who understand best who's in which classroom, what are those risk exposures, et cetera, focus on the within school contact investigation. And then the Chicago Department of Public Health contact tracers and case investigators focus on the settings outside of school. And so there's really a lot of resources again into this, and I think it went quite well last year in terms of really in short timeline making sure notifications are there and decisions are made. And it can be very stressful, I think, for parents and students and staff and everybody. But at some level, COVID is going to be a part of the school year, and there are just routines that become something that we follow. And this, I think, is going to be one of them.
Well, it's my understanding that because of the 3 feet physical distance, especially at the elementary schools, will be contacting the entire classroom. So it doesn't mean that your child was infected. It just means that they were exposed.
Right.
And what we need to look for symptoms, confer with a health provider, and make sure that if your child is sick, please do not send them to school.
Yeah, and can I just double down on that? Because I think that's really important. What we've seen, consistently is that right now, especially, even if folks are vaccinated, if your 12 to 17-year-old is vaccinated or you're a vaccinated staff member, if you're having symptoms that could be consistent with COVID, we don't want you just to assume it's a cold or it's the flu or something else. We really want you to take a COVID test and not run the risk of exposing others. And that's going to continue to be just that was the first health order we ever passed in the city of Chicago, and it remains really central. So along those lines a little bit, Sandra Lang on Facebook is asking, she's both asking about what are protective masks for kids, which I'll take, and then how accurate are home COVID tests. So just very briefly, we're going to talk some more about masks in detail on Thursday because we're getting a lot of questions about different kinds of masks, and the most important thing is the mask that your child will wear, right, or that you will wear. And by far the biggest benefit is when you go from no mask to some mask. But there are some differences related to masks and protection, and we've gotten some questions about K95s and everything else. So if you want to tune in on Thursday, we're going to bring some masks and talk into a little bit more detail about that. How accurate are the home COVID tests? They're good. The home COVID tests, again, there's different kinds there, but the one people usually are referring to are the antigen tests. Binax now is one of the companies that makes them. It's the 2-pack for about $24. You can get it over the counter. You can order it online from Walgreens or CVS or Target or Walmart or others. And those are good, especially if your child or you, are having symptoms. It's a very, very good test. If you're not having symptoms, it's still a good test. And it's the one that you can just take it home and have a result of in 15 minutes. It's like a pregnancy test. You see it right off the bat. And then the PCR test is a little more sensitive, meaning it's more likely to pick up COVID infections. So sometimes we'll do that initial screen, but then if someone is really having symptoms and you're not sure, you might still need to stay home and or get a PCR test. But I strongly recommend those home COVID tests. They are approved for children, who are very young, and they're self-administered, and I think it's very helpful to have them available at home. So if somebody's got symptoms, you're not running around trying to find a test for them at that point. Okay. Jess P. on Twitter says, is there any possibility kids over 16 or over 12 might be able to consent to vaccine on their own once there's full FDA approval, like the HPV vaccine? Seems like there are some teens who want it, but parents won't allow them to get it. I'll take that part, and then if you want to talk a little bit about sort of in the CPS setting and kids and vaccine. So certainly we first need to get the full FDA approval, and you are definitely right on that. While it is under emergency use authorization, for kids specifically, there is a parental requirement in place. What we are doing more exploration of is, and even this summer, for example, with After School Matters, where parents could do permission slips as opposed to needing to be there in person for the vaccination, because we know if people are working, et cetera, that can be one barrier. I expect, based on Illinois law down the line, once it's fully approved, that teenagers likely would be able to give their own consent, but that won't be possible until it does have that full approval for teenagers. Do you just want to chime in about kind of kids and teenagers and vaccine?
Yeah, so we have 3 sites right now: Clark, Roosevelt, and Vocational Career, and we have been able to administer up to 200 doses at any one of those sites, and we take walk-ins as well. Once school starts, we have also brought the vaccines pop-up sites at back-to-school bashes and to wherever people might request it. Once school starts, we'll be bringing vaccines to the schools as well, and so we hope that many parents will sign or approve for their children to be vaccinated, and we think that's the best prevention. Yep. For when school starts on Monday, August 30. Monday,
August 30, yeah. And just to add, again, this is a best practice for other childhood immunizations. We know, people have complicated lives, and, making this available, obviously, with the appropriate parental or guardian sign-off is important. Lee Mabry White on Facebook, just to follow up on testing. What about people who don't have money for tests? Yeah, great question. Chicago.gov/COVID test has a lot of options available. There remain completely free testing options available in Chicago. Just highlighting that, that at-home one is sometimes one, if people are able to afford it, they like the convenience. We're also exploring, actually, making some more of these at-home tests available, potentially in some of the higher need areas free of charge. But for right now, chicago.gov/COVID test, and you can find a lot of information about testing, including testing that's totally free of charge. Okay. Ramon Noriega on Facebook, when will a COVID vaccine be available for children? Oh, the million-dollar question. I don't know just yet. We are expecting a vaccine for older children. It looks like it's probably going to be that 5 to 11 year cutoff later this fall. We were hoping it was going to be a little earlier in the fall, and then the FDA actually requested some additional children be enrolled to follow up on some of the safety and dosing. And again, you know, this vaccine is only going to be approved for kids when we're sure that everything is completely good to go. So I know people are impatient for that to come through, and I think things are on track for sort of a later in the fall. You know, might it be November? I don't know for sure. It's not going to be in the next few weeks, though. We're definitely going to be in school before that vaccine for the younger kids is available. So, good question. All right, we are coming up on time. Are there things that you feel like you want to share that nobody asked a question about?
No, so I think, again, just to reiterate, school starts Monday, August 30, face-to-face, 5 days of instruction. We have taken all the precautions that our partners at CDPH and IDPH and CDC have offered. We believe it's safe, and we are excited, actually, to have students come back to meet with their peers and learn with each other with all of the mitigation efforts that we've put in place, such as universal masking, contact tracing, ventilation efforts, hand washing, 3 feet social distance, in wherever possible. So.
Great. And I'll just add as a little bit of a plug, as a reminder, you can walk into any pharmacy or almost any pharmacy across Chicago, even without an appointment, and they will vaccinate down to the age of 12. So that is an easy way for you or your family to access vaccine. CPS is also running vaccination events. So Tuesdays 9 to 1 at the Chicago Vocational Career Academy on East 87th. This Wednesday 9 to 1 at Theodore Roosevelt High School, 3436 West Wilson. Thursday 9 to 1, Michelle Clark High School at 5101 West Harrison. This Friday 12 to 5 at the Coleman Administrative Office, 4655 South Dearborn. Next Friday at the Chicago Vocational Career Academy. So all of that is available online, but to be clear, you are welcome, and we love folks to get vaccinated at the CPS vaccination events, but we just need you to get vaccinated. So your records count if you get vaccinated at a pharmacy, if you get vaccinated with your pediatrician, if you get vaccinated through a primary care provider. They all count, they all get registered, but CPS obviously is wanting to make it available specifically. So anything else you wanted to add, or you're all set?
CPS.edu for more information.
All right, perfect. We will be back this Thursday again we're going to talk some more about masks, we're going to talk some more about boosters. We're going to have another sort of pediatric associated guest, Benjamin Kagan, who is a 15-year-old here in Chicago, who was part of the Chicago Vaccine Angels, worked to really think about tech and hooking his grandparents up and others, someone, you know, a Chicagoan who's really done a lot to access vaccine, but we also want to talk about school and teenagers and some of that. So please tune back in on Thursday. There's a lot more to talk about. I am on vacation next week. I know. I was supposed to go. Some people who have been following, theoretically I was going to go to Ireland. Clearly that is not happening with the surge. But I will be spending part of the week in Michigan, which is one of the states still doing very well from a COVID perspective. And then I'll probably be back here later in the week. But we definitely won't be on Tuesday, and most likely not on Thursday. But the team is working like crazy. There are multiple town halls that with CPS, and you know, this has been about CPS, but obviously there's similar work happening with other schools here in Chicago. So if you've got other questions, tune into those. If I'm not on them, you know, our docs from Chicago Department of Public Health are, and you know, we really want to get your questions answered.
Yeah, I should say that we have a town hall meeting this evening from 6 to 7 for parents, one tomorrow in Spanish for 6 to 7, and then one on Thursday from 6 to 7 in English. Again.
All right, great. And those are available online?
Yes.
Okay, perfect. So if you didn't get your question answered today, go ahead and put it in there. And thank you again so much for tuning in, for all your really good questions. We'll be back again next Thursday, and 2:30 today we'll be doing a press conference more broadly about what's happening in Chicago. Thanks so much for tuning in, and thank you again, Dr. Torres, for being here.
Thank you, Dr. Awadi. Thank you.